This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Imagine right now the very thing that's supposed to protect you against viruses and infection is attacking the healthy organs in your body, literally fighting itself. That's what happens for millions of people with autoimmune diseases. One of those diseases is lupus. There's no cure, but now there's hope on the horizon, and you'll meet one new mom trying life-changing experimental therapy.
I've been relatively pain-free, which has been a first for me in a really long time.
Also, a woman's chronic autoimmune disease led to kidney failure. That's when a hero stepped in.
I've been through a lot of things, and my dad's always the first person to be like, all right, I'm coming to save the day.
Plus, the connection between nightmares and lupus and how these vivid images can improve patients' care. It's all straight ahead on this week's edition of Prescription for Life. Hello and welcome to Prescription for Life. I'm Monica Robbins. Lupus is an autoimmune disease that's considered rare, but it can attack multiple organs in the body. Symptoms can develop as extreme fatigue, joint pain and swelling, to skin rashes, but it can cause even more severe damage. 90% of people living with lupus are women, and most women begin to show signs between the ages of 15 and 44. One of those women is Sierra Butler of West Virginia. Doctors diagnosed her with lupus when she was just 23. Take a look at how a new clinical trial is giving her and many others hope. In 2020, while in college, Sierra Butler learned lupus caused her rashes, fatigue, and extreme joint pain.
Unfortunately, I have a specific type of lupus that's pretty stubborn, so I have drug-resistant lupus.
It became much worse.
I was pretty much on my deathbed, in and out of the hospital every week. Kidney failure, which was leading to severe cardiac distress.
Her West Virginia doctor sent her to Cleveland Clinic.
When I first came to the Cleveland Clinic, I was in a wheelchair. I was not able to walk. I was bald because I had lost my hair to previous treatments. I was really, really ill.
The clinic helped stabilize Sierra's lupus, eventually helped her and her husband have a baby. In February, she qualified for the CAR-T therapy clinical trial. Similar to a bone marrow transplant, Sierra's blood provides T cells. They're sent to a lab for lupus-fighting modification. She hunkered down in the hospital while chemotherapy destroyed her immune system, so her recharged T cells could be given back and begin fighting her lupus.
I've been relatively pain-free, which has been a first for me in a really long time. And then the other big thing that I've noticed is my energy levels have really increased, which fatigue was a big issue for me.
The big milestone for these patients would be that they stay in disease-free remission for 6 months to 1 year. That would be my hope, because in this space, like I said, that's even a huge milestone for them. If they can go 2 or 3 or 4 years, that would be life-changing, and to me that would mean that it's likely that the disease is really put into remission, and remission is not a term that we typically use for lupus.
There are some things that have happened in my body that may be permanent from what we know right now, like scar damaged tissue, but getting this treatment, it's not just hope in this treatment, but it's hope in all further research, and it's not just hope for lupus, it's hope for all autoimmune conditions.
Now to Sierra's doctor, who's hopeful about this new treatment for lupus. Joining me now is Dr. Emily Littlejohn, who is the director of Cleveland Clinic's Lupus Clinic. Thank you so much for being here.
Thank you for having me.
We have a lot to unpack, so let's start from the very beginning. What is lupus?
Lupus, or systemic lupus erythematosus, the full name, is a chronic autoimmune condition that affects women typically of childbearing age, so 18 to 45. And this is an autoimmune disease where the body attacks itself. And the areas where the body attacks is the area that we see damage.
How dangerous can it be?
The symptoms can range from joint pain, shortness of breath, rashes, to things that are organ damaging, such as renal failure or lupus in the brain.
So it can be potentially fatal?
It can. It can lead people to be on lifelong dialysis or be a candidate for renal transplant.
So how do you know if you have it?
Diagnosis of lupus is complex. It requires both blood work, urine studies, and an exam by a physician. And while we have criteria that patients have to meet, it's always at the discretion of a physician's assessment, which oftentimes includes things like biopsies of the skin or the scalp or even the kidney.
So is it usually something that takes a long time to diagnose?
Unfortunately, about 5 to 10 years sometimes.
Wow,
because
really?
oftentimes the clinical symptoms don't mirror what's happening in the blood.
Wow, how long, so at what age, or is it typically an age where symptoms start to appear?
18 to 45 is the range we see lupus. I would say the majority are between 18 and 30.
Wow. So is there a common symptom that typically appears first?
The most common symptom is a photosensitive or a sun-sensitive rash, which happens on the face. And the word lupus actually is derived from the Latin term lupo, due to the rash, which is typically on the forehead, on the cheeks, and across the bridge of the nose and looks like a wolf. So rash is probably the most common manifestation that we see. But I would say the worst manifestations are those that you cannot see, such as fatigue, brain fog, inflammation of the heart and the lung, renal failure, issues with the kidney, or what's called lupus nephritis, which is the worst, most severe manifestation.
Are any ethnicities at higher risk than others?
African ancestry and Hispanic patients, also those of Alaskan or Pacific Islander.
Wow, okay, so once you get diagnosed, what do you do? And actually, if you think you have it, where do you go?
I think the first step is seeing your primary care physician and then a referral to a rheumatologist. A lot of this lab testing is very nuanced in the lab, meaning it's very specific and the interpretation takes a lot of work. Every lab does these tests a little bit differently. So seeing a rheumatologist is really the first step. He'll take a thorough history, do the blood work, do a full workup, and then talk with you about the results.
So then treatment, where do you start?
The treatment landscape has been very meager in the last century, I would say. I think in 2020 is when things turned around, which means there were 3 drugs that were approved for lupus. But prior to that, we've been borrowing drugs from rheumatoid arthritis and the oncology space. We often treat this disease with chemotherapies. So until 2020, there was not a lot of options. Now there are more, but I will say treatment failure occurs in up to 45% of patients.
Wow, so it's an inflammatory disease. Is this something that, like, usually steroids are a common treatment for this?
Steroids are usually the most acute treatment. So typically if patients have symptoms right away, we put them on steroids while we start them on other medicines that are going to take longer to work. So steroids are the first step, and then low doses of chemotherapy.
So how are these newer drugs working?
The newer drugs are mostly working with patients who have lupus in the kidney or lupus nephritis, because we found that that's where we're doing the worst in terms of outcomes. And these medicines are, like I mentioned, new medicines that are just for lupus, but they do mimic other drugs that we've seen. So for example, drugs for anti-rejection or drugs for leukemias and lymphomas.
How common is lupus?
Not very common. It's considered a rare disease. We think in the US there's about 300,000 people with lupus right now, but there's a diagnosis bias, meaning we probably aren't diagnosing enough people.
Is this one of those illnesses that, you know, women get brushed off a lot, are told that it's all in your head?
That's a good question. I think because fatigue sometimes predates a patient's formal diagnosis, patients will have fatigue and brain fog, aches and pains, and they'll blame it on other things. For example, a new mom might blame it on childbirth, or someone might have another problem happening and they'll blame it on another chronic disease.
And the rash is, you know, oh, you're stressed out.
Sometimes, although the rash is pretty specific in that if we take a biopsy of the rash, we actually see lupus in the histopathology. So that's why a biopsy is always best, is what we tell patients. Biopsy of wherever there's an abnormality, a canker sore, the skin, the scalp, or the kidney.
So now there's a new treatment out. Well, at least it's experimental. It's a new treatment for lupus, but it's been out for other things. Let's talk about that.
CAR T therapy. So yes, this was initially been studied in leukemias and lymphomas and has done very well in that space. It's actually approved by the FDA in that space. For autoimmune diseases, it's very new. And what we found is these young patients who have multi-organ involvement and refractory disease. So they have tried a lot of different medicines and they have not worked. We found that they've gone into a drug-free remission, which is a word that's unheard of for lupus. So it's really life-changing for these patients.
So it works for B cell. Explain what B cell means.
So our white blood cells constitute a few different types of cells, including T cells and B cells. And in this therapy, we take a patient's white blood cells and we filter out the T cells, and then we genetically engineer them with a new receptor. We then put those cells back into the patient, which finds these specific B cells, like you mentioned, and depletes them. The B cells are the ones that are responsible for making these missiles or these autoantibodies that cause the inflammation in the body.
So how does it work? So walk me through, because Cleveland Clinic is part of this research. How many patients have you done it with?
We're hoping to get about 5 total. We've completed 2. And the way that it works is patients come in for a consultation, we screen them, we talk to them about the procedure, what it's going to mean for their life and them going forward protocol-wise. They then come in and they have leukapheresis, which is when we take out all their white blood cells. We send that sample to a lab where it gets genetically engineered and modified. And then right before they come back, we give them high doses of chemo to reset or wipe out their immune system. They then get admitted to the hospital, the bone marrow transplant unit, where they get reinfused with their own cells that have been modified. And then we watch and wait. So usually at day 14, they're healthy enough, their cells have come back, they get discharged. And then going forward, we continue to watch them very closely with blood work, touching base with them, seeing how they feel, and miraculously, they've both done very well.
So what preliminary studies, what have they shown so far?
Our patients who have lupus in the kidney, we found that has completely gone away. We see that this therapy has almost melted, if you will, the lung disease and the heart valve disease that can come with this disease. But in terms of quality of life, these patients have less fatigue. One patient told me she's much less anxious. We're going to reverse her disability status soon. So it's given these young women a chance at having their life back, frankly.
So how long ago did they get the treatment?
In these 2 patients, we began in early 2024.
Wow. So
we're at the very beginning of following them up. The initial studies, though, that did this CAR T therapy were in 2021, and those patients now have years of data behind them, and they've all stayed in remission except one who was reinfused with the CAR T therapy and is now doing well.
So where are we on this CAR T therapy from a research standpoint?
We're at the very tip of the iceberg. This is a phase 1 trial that we're doing, which means we're just gathering data, making sure this is very safe, figuring out outcomes and side effects. I think once it gains more traction and we get more numbers, we'll have more information and more evidence to provide this to other patients.
What are the obstacles involved in this therapy?
Well, it requires a 2-week stay in the hospital here, which is the big one. I've had patients who are unable to participate because they can't take time off of work, which is another one. And you have to be a perfect candidate in that you have to be sick enough and tried enough other therapies, but not too sick to not tolerate the high doses of chemo and the process. So right now it's this very specific group of patients that we're looking for.
So the chances of this getting approved for lupus, though, we're still several years away.
I think so. I think it's very hopeful, and I think we could then extrapolate this information to other autoimmune diseases, things like scleroderma, myositis, and these other rare diseases that we see.
When we're talking about this, though, what's going through my mind is type 1 diabetes. Potentially, rheumatoid arthritis, potentially, if it works.
I think the reason why it's been tried in lupus first is because of the huge unmet need that there is in that space. We have a lot of treatments for rheumatoid arthritis. You know, even in the last 10 years, there have been a lot of new drugs for that disease, and same with diabetes. But yeah, you're right, potentially can be curative for other autoimmune diseases.
All right, so what's next on the, besides CAR T therapy, what do you think is next on the lupus horizon for treatment that's realistic, that people can get access to?
My honest opinion is that the CAR T therapy, the backbones of how this is structured, is really wonderful and very hopeful. Now, the way that we're engineering these cells specifically, we're using one marker, a CD19 marker. There's a lot of different markers that we can use, and I think eventually we'll find the perfect marker. I don't know that we're there yet, but it will just be a different permutation off the CAR T therapy. Okay,
let's look ahead 10 years. Say it works, it's approved. Are insurance companies going to pay for it?
If I could answer that question, I wouldn't be here right now. I would hope so, particularly in these patients who have no other options. I don't see how they would have other options. And some of our therapies now, these infusion medicines that we give them, are not cheap either. So it would be terrible if payment would be the big block.
Because we know CAR T therapy is very expensive. So what's your hope? What are you anticipating the next step to be year-wise?
The big milestone for these patients would be that they stay in disease-free remission for 6 months to 1 year. That would be my hope, because in this space, like I said, that's even a huge milestone for them. If they can go 2 or 3 or 4 years, that would be life-changing. And to me, that would mean that it's likely that the disease is really put into remission, and remission is not a term that we typically use for lupus.
Wow. So is there a time frame that we have to see relating to the study? Are we looking at it must be 5 years for it to be considered for approval?
That's a good question. Unfortunately, I don't have that information. It's very much about the data showing all the other patients, because we're not the only site in this trial in terms of safety and efficacy, meaning how powerful and useful this medicine is. I would think within 2 to 3 years we'd have enough information, because things really got started rolling on this in 2021.
Okay.
So my hope would be within 5 years.
Is it worth a phase 2, or is it just something that could be fast-tracked if it's working?
Probably worth a phase 2, because we're still figuring out dose.
Okay. But this is the biggest hope.
This is the biggest hope.
I mean, we're talking cure here.
This is a big deal. And that's a term we don't use, like I said, when we speak to these patients about it. A lot of times they have family members who have lupus. This is a disease that runs in family. There's a genetic component. And a lot of times they've seen a family member or a loved one struggle their whole life and potentially die from lupus. Wow. So using the word remission or drug-free remission is a big deal.
That's incredible. Dr. Littlejohn, thank you so much.
Thank you for having me.
Still ahead, this family is all smiles as they celebrate the gift of life.
I was like, he's gonna be like, make sure you take care of my kidney.
She needs to take care of what I gave her.
Plus, the connection between nightmares and lupus, all straight ahead on Prescription for Life. Welcome back. A new study shows nightmares and daymares may be a little-known sign of the onset of lupus and other systemic autoimmune diseases, such as rheumatoid arthritis. In the study, published in the eClinical Medicine Journal, researchers found 3 in 5 lupus patients and 1 in 3 patients with other rheumatology-related diseases had increasingly vivid and distressing nightmares. The unusual symptoms may also be a signal that an established disease may be about to intensely worsen or flare and require medical treatment. Doctors say recognizing these early warning signs could help improve care for patients and alert medical teams to step in to prevent flare-ups. Giving birth is supposed to be the happiest time of a woman's life, but a mom in Virginia learned she had lupus just after giving birth to twins. The disease attacked her body, leading to kidney failure. Her father stepped in without any hesitation to give his daughter the gift of life. Emily Harrison has their story.
I just think it's my responsibility as a father. She got life one way from me to get here, so I think as my father, while I'm still able to, I should do that for her or any of my children.
David Person says he didn't let anyone else get tested to be Jessica's kidney match after doctors accepted him as his daughter's living donor. The decision came after years of watching Jessica suffer from lupus, which she discovered after giving birth to twins.
They did the biopsy, and the biopsy confirmed what she thought it was. And then after that, I was in and out of the hospital, probably for like a week at a time for a couple months.
Jessica almost immediately went on the donor list, but she entered kidney failure while waiting years for a new organ. That's when David took the match test, and he became her donor. It's something Jessica says he won't ever let her forget.
He's never gonna let me live this down.
Oh yeah, all the time, you know, so she has more now of a part of me than ever.
I was like, he's gonna be like, make sure you take care of my kidney.
She needs to take care of what I gave her.
Beyond all the teasing, Jessica says she's grateful to her dad, who she says saved her life.
I've been through a lot of things, and my dad's always the first person to be like, all right, I'm coming to save the day.
David says he would do it again and urged others to consider becoming a living donor.
Emily Harrison, 13 News Now.
That'll do it for this edition of Prescription for Life. Thank you so much for watching. Join us next week for another dose. Until then, I'm Monica Robbins, wishing you and yours good health.
Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.